Hi guys, it's Monique from earlylearningmom.com. I promised some videos and then all of this craziness started. I'm not sure how things are in your neck of the woods, and I really hope everybody is safe. Here in Manitoba, in Canada, we have about 20 cases of coronavirus, but they are all travel related. And I'm super proud of, for the most part, of our local government that has been shutting things down and putting a lot of strategies in place to hopefully flatten the curve. So, that being said, we had some craziness. 2 weekends ago, not this past weekend, but the weekend before, Friday night, Z developed a fever and a cough. And everybody knows right now if somebody coughs in the grocery store, everybody stops and stares, and it's kind of a panic. However, I knew he wasn't exposed. Well, for the most part, I figured he wasn't exposed to anybody with the coronavirus at this point because the numbers were quite low in my town, home, like city of Winnipeg. That being said, no clinic would see him. Our regular doctor's office is a Monday to Friday kind of jazz, and so they weren't available. And the regular walk-in clinic that we went to, okay, so I really didn't like the lighting over there, so I just switched over here. So the regular walk-in clinic that we usually go to, and the doctors there are amazing and they work awesome with Zakari. As soon as I said cough, fever, and his dad was in Vancouver about a month ago, wouldn't touch us. Now, mind you, the travel self-isolation rule is 2 weeks. But as soon as they found out that like 3 weeks prior, I had been in the States, 4 weeks prior, my husband had been in Vancouver, they wouldn't touch us. And so trying to get a hold of health links was a nightmare. And so I landed up, the clinic gave me a different kind of like health links number to call. I was able to get a hold of them. They directly contacted a pediatrician at Children's Hospital and they told us to go in. So we went in and Zakari's hacking. He wouldn't wear a mask. And I mean, like, we do masking for our Doman program, but he would not put the mask on because it was different. And they swooped us into isolation. And we sat in isolation for 4 hours. And I can't imagine what that cost our healthcare system. And had we been screened properly, which it's my understanding that the screening process is going a lot better now, and we would have been allowed to go to the clinic, but then this was all fresh and new. So we went and waited in isolation for 4 hours. And it was like, luckily, like, I know the room is clean, I know it's but keeping Z busy for 4 hours was very difficult. And I knew it wasn't coronavirus. I knew that it was likely an ear infection because that's really the only times he ever gets fevers. But I knew they had to do their due diligence. So by the time the doctor came in, well, first of all, halfway through, Z needed to use the washroom. And they had told us if we opened the door, an alarm would go off. So to use the buzzer. And I used the buzzer and waited. Nothing. Turned the buzzer off, turned it back on, nothing. Finally, I landed up using the phone that was in the room to call the emergency room to tell them that we were in isolation and my son needed to use the washroom. Were we allowed to leave? And it turns out we were there's 3 rooms to a pod, and we were the only ones in that particular pod. So we were allowed to use the washroom freely. So I wish they had told me that, but everything is so new to everybody. Nobody has lived through this before. And I knew they were just trying to be very careful. So we went in, we were able to use the washroom. A little while later, probably about 2 hours later, the doctor comes in and he's in gown, mask, glasses, everything. And he starts doing the screening process. And he's like, well, I'm not entirely sure why you're here and why you didn't go to a walk-in clinic. And I told them the walk-in clinic wouldn't see us because my husband had been in Vancouver, I had been in the United States, but it was past the 14-day period. So anyhow, he checked Z out, and sure enough, he had an ear infection in his right ear. And so at this point, the Advil I had given him before we left, or in like a few hours before we left, and finally got the okay to go to Children's, had worn off. And he was in so much pain. And so the doctor's trying to talk to me. And finally, I just said to him, I'm like, could we please get the Advil on board? And that way he can start getting out of pain. And so the doctor left the room, filled out a prescription for our antibiotics, gave us a dose of antibiotics there just in case we couldn't, because at that time people were rushing to the pharmacies to get their prescriptions. They were rushing to the store to get toilet paper and food and everything. So it was just a crazy time. So he did give us a dose just in case it took us longer to get our antibiotics. And when he came back in with the prescription, he was in his regular, doctor's getup. Like, he wasn't in any extra protection gear. He didn't swab Z. He didn't see the purpose to swab him because he wasn't a candidate and he just had an ear infection. So it took us 4 hours in isolation at Children's Hospital after trying to get a hold of HealthLinks for 12 hours to finally get this prescription. He is doing a lot better now. I'm so grateful to our chiropractor because we've been getting regular adjustments since June. Yeah, that was probably after Z's really bad ear infection in May. We started in June, and I'm noticing the benefits to the chiropractor are less after pains. Like, I found he would get, his ears would get so irritated that even though the infection was gone, his ears were so sensitive. And he had to take Advil for weeks after an ear infection. That I'm not seeing anymore. I'm also noticing the antibiotics seem to work faster. It used to take us 48 hours to 72 hours before we would get any pain relief. After 2 doses of the prescription this time, we could stop Advil. I think I gave him Advil one more time later on for some slight after pains, but that was it. Whereas back in May, when he had his ear infection then, we were suffering from after pains. He could not be off the Advil. So huge shout out to my chiropractor for getting things lined up. Like, I know they're not allowed to say, ear infections, chiropractor benefits people that have ear infections, but it definitely helps the immune system fight better. And it gets everything lined up. And I know it sounds crazy, but I've just seen it. And I see with myself too. I'm healthier this end of winter, early spring than I have been in past seasons, just from regular chiropractor adjustments, and my migraines have dissipated to almost none anymore. So I'm grateful that he is taking the risk. And during this coronavirus outbreak, the chiropractors have been deemed essential services. But he has to run his practice so particular, making sure, he has extended his hours so he could spread out his patients. So that way he can make sure to see everybody without having a crowded room. In the mornings, he is doing private appointments, especially for elderly or immunocompromised. So today, actually don't have any daycare kids. I am still running daycare, but under strict, we haven't been shut down yet, and I have families that need to work. So, but today it just worked out that I didn't have anybody, so we went in the morning. We had the office to ourselves. And so a big shout out to him. And yeah, so that was our coronavirus craziness. I'm happy to say, from what I hear, HealthLinks has now increased their call capacity volume. They can take more calls. I believe the wait time is 45 to 50 minutes, which compared to 2 weeks ago, I was calling and I couldn't even get a place in line. It was busy. They So shout out to those nurses. And they even have student nurses that are stepping up and, you know, grabbing a phone and helping out people decide where they should go. And so yeah, anyhow, I have more to share about this, but this video is already long enough. I just wanted to share our crazy story. It's something I want to remember about this time because I really believe this is historic times right now. There's a lot of conspiracy theories. There's a lot of people thinking that this is something, and we don't know what it is. But what I do know is this is history being made. Things are going to change, and it's an interesting time anyhow. So I hope you guys are staying safe. If you haven't already, like, subscribe. I talk about motherhood. I talk about raising children with autism, homeschooling. We are an eclectic family, so I have one in private, one in public, and one that we homeschool. And right now, they're all homeschooled, so for the time being. So anyhow, thanks for watching, and I hope to see you guys soon.